Welcome to the Direct Data Entry webinar training for dental claims submitted through the ProviderOne portal. We are conducting this webinar due to the policy change at the Washington Healthcare Authority, where we are no longer accepting paper claims unless you have an approved waiver. This was implemented on October 1st, 2016, and we're hoping to reach those providers who have only submitted paper claims and need to transition to electronic billing. This training will focus on billing electronically through the direct data entry system in ProviderOne and will not cover HIPAA EDI claims. For more information on HIPAA billing, please visit the following webpage, www.hca.wa.gov/billers-providers and click on the third link under the blue Claims and Billing bar titled HIPAA Electronic Data Interchange. I'm Marcy Teege here with my coworker Matt Ashton. We will be reviewing our PowerPoint slideshow first and break down each field required to submit the claim and then show a live demonstration of entering a dental claim through ProviderOne. Any questions received during this webinar will be collected and answers to those questions will be posted after this webinar along with the recording of this presentation. Only questions related to direct data entry billing will be responded to. After this training, you will be able to submit fee-for-service claims through the ProviderOne portal and submit claims for clients who have commercial insurance. Before we get started, there are some important settings on your PC that need to be verified before you begin. Make sure your pop-up blockers are turned off. The process to turn off pop-ups is different depending on what browser you are using. ProviderOne uses pop-ups throughout the claim form and must be turned off to finalize the claim. ProviderOne is a HIPAA-compliant program that gives you the ability to enter claims directly into the payment system, and all fields that can be entered on a paper claim can be billed through direct data entry. It is easy to use and does not cost anything to do so. As long as you have the correct profile and access to your domain in ProviderOne, you can bill as many claims as needed using multiple PCs if necessary. You can correct and resubmit denied or voided claims, or adjust or void previously paid claims. Corrections and resubmissions will not be covered during this session. However, see the contact email for provider relations on the last slide if you need to reach out for assistance on these functions. Once you have entered your domain, username, and password, you need to choose a profile. There are several profiles that allow for claim submission. The most frequently used is the EXT Provider Super User Profile. This profile allows the worker to do all functions in the system except for managing user permissions. If an incorrect profile was chosen, ProviderOne gives you two ways to change it by using either the My Inbox tab or dropdown, or by hovering over the username in the upper left corner of the portal. For this session, we will choose the EXT Provider Super User Profile. Once you have chosen the correct profile, you would then choose Online Claims Entry from the Provider portal. You would then choose the claim type you would like to enter. A dental claim submission would be the same as the ADA 2012 dental claim form with all the same fields available for entry. Here is a snapshot of the first half of the direct data entry screen. The claim itself is broken down into 4 different sections: billing provider, subscriber or client information, the claim level or header information, and the service line level. There are also some basics on navigation that we should discuss. Do not click your back arrow on your browser but use the hyperlinks and buttons on the screen itself to navigate. You also must complete any question or field with the red asterisk. And if you expand an area by clicking any of the red plus signs, you must either enter the detail required or close that area by clicking on the minus sign. Otherwise, ProviderOne will be looking for entries in these expanded areas. Here is the second half of the claim form showing the required entries. We will break down each section and show each field and what is required to submit a claim. Let's start with Section 1, Provider Information. The first thing to do is tell ProviderOne who the billing provider is by entering the National Provider Identifier, or NPI. The billing provider is where payment will be sent to or who is getting paid for the service. You will also need to enter a taxonomy code that is attached to the billing NPI and applicable to the service you are billing for. The taxonomy code tells ProviderOne what type of provider is submitting the claim. Note the red asterisks as these are required entries. Now you've come to the first question that must be answered. Is the billing provider also the rendering provider? This represents the provider actually performing the service. If you answer this question yes, you are saying that you are both the billing provider and the provider rendering the service. Otherwise, you would answer this question no. Answering the question no opens up the rendering or performing provider area where you would enter the NPI and taxonomy for that provider. That completes the first section, and we're now in Section 2, Subscriber or Client Information. This is where you will tell ProviderOne what Apple Health client received the service you are billing for. This is the ID number noted on the ProviderOne services card that each client receives. You must enter the WA, but it does not need to be capitalized. The next step is to expand the additional subscriber client information by clicking on the red plus sign. This is where you would tell ProviderOne the Apple Health client's name, date of birth, and gender. You will note that the first name field is not required or marked with the red asterisk. This information must match what is in the client's file in ProviderOne. If the Apple Health client has a commercial payer as their primary insurance for dental services, you will need to complete the Other Insurance Information fields by clicking the red plus sign to open this section. Click the very next plus sign for Other Payer Insurance Information. In the Payer Insurance Organization name, enter the commercial payer name. Once complete, expand the red plus sign for the additional Other Payer Information section. Only two fields are required here, the ID and the ID type dropdown. The ID needs to be the insurance carrier code that is listed on the client's eligibility file, which we will show on the next slide. The ID type dropdown should always be PI for payer identification. This is a snapshot of a coordination of benefits segment from the client eligibility screen in ProviderOne, where you will find the insurance carrier code or the ID number from the previous slide. If you need more assistance on finding the carrier code in ProviderOne, please review our fact sheet titled Successful Eligibility Checks Using ProviderOne at the web address noted on the slide. The next entry is to tell ProviderOne how much the commercial insurance paid by entering the amount in the COB payer paid amount field. This amount can be entered without decimals if it is a whole dollar amount. If the insurance denied the service, you would enter a 0 here. ProviderOne requires the use of HIPAA-compliant adjustment reason codes. These codes will be entered by expanding the Claim Level Adjustments section. Once expanded, you would enter a group code, reason code, and dollar amount applicable to the reason code entered. The HIPAA-compliant reason codes can be found at the WPC's website at the address noted in the green box. The next section to complete is Section 3, Claim Information. This is also called the Claim Header Detail Information that covers the entire claim. The first field to complete under Claim Data is for the patient account number. This is not required but can be used by your office to identify the client using your own identifier or account number. This number will be carried forward to the weekly HCA remittance advice to assist in reconciling accounts. Next, you need to tell ProviderOne what date you saw the client. These dates must be entered in complete digits as noted on the screen, such as using a 4-digit year. The date of service can also be entered on each individual service line. However, if only one date of service is being added to the claim, you only need to enter it one time at the claim level. The next entry is to choose your place of service. Most often you're choosing office, so you can use the number 1 to easily jump down to place of service 11 or use the drop-down to select from the list. Additional claim data is needed only if the Apple Health client has a spend-down liability they owe that needs to be reported on the claim. You would choose the red plus sign and enter the liability amount in the patient paid amount field. The next area for entry is the prior authorization section. You would click the red plus sign and enter it here if the service you are billing for requires a prior authorization or an expedited authorization number or EPA that is provided in the program billing guides. If no authorization is needed for the service, skip this area. Entering the authorization or EPA number here would apply to the entire claim. If you have more than one authorization number to bill with, this will be covered later in the slideshow. Recent system changes to ProviderOne have changed how claim notes are read. If a specific program or service requires you to enter a claim note as instructed in a program billing guide, they will still be read by ProviderOne. If no claim note is needed, skip this option. Here is the last required question on the dental claim form. You will always answer the question, is this claim accident related? As no. If an Apple Health Medicaid client has a casualty-related claim, it is handled by a specific unit in our Coordination of Benefits office. That completes Section 3, and now we will review Section 4, Basic Service Line Items, again covering each required entry. The first item to enter on the service line is the procedure code. Enter the CDT code from the most current coding manual and always enter the D in front of the procedure. You would then enter the amount you are billing for in the Submitted Charges field. Again, if this amount is a whole number, no decimal point is needed. We always recommend that providers bill their usual and customary amounts here. However, if the service you're billing for required a prior authorization, you must bill the amount that you requested in the authorization. The place of service is not required on the line level, so can be skipped, as well as modifiers and diagnosis, as these are also not required on a dental claim. If the CDT code you are billing with requires a tooth number, you would click the red plus sign to expand that area and enter the tooth number. This is also where you would enter a tooth surface if required. You will note that the Add Another Hyperlink is crossed out on this slide because you should only bill for one tooth per service line. Each procedure you entered will require units. Enter the number of units you are billing in this field. It is necessary to call out that you would not bill minutes for anesthesia in the units field. Using an anesthesia procedure code, each 15-minute increment equals a unit of service. Please see the Dental Program Billing Guide for more information on anesthesia services. Also, if you are billing more than one date of service on the claim and are entering it at the line level, you need to make sure you bill the first or earliest date in the claim level area, or you will receive the error message noted on this slide. If the procedure you are billing requires a quad or arch designation, you would enter it here using the drop-down boxes. If the authorization number for the procedure being entered is different than the one listed at the claim level or header area, click the red plus to expand the prior authorization area and enter that number here. Skip the additional service line information section. Once you have entered all the required information for the service line, click the Add Service Line Item button to add the service line to the claim. It will remove the information from the service line area and populate the columns below the gray bar, similar to an ADA 2012 claim form. If there are additional service lines that need to be added to the claim, you can quickly return to the service line area by clicking on the service hyperlink shown here and follow the instructions from the previous slides. If the service line was entered incorrectly and needs to be updated, you would click on the service line number. This will repopulate the service line boxes for you to make any corrections. Once your changes or corrections are completed, click on the Update Service Line Item button to add this service line back on the claim. If you added a service line in error and now need to remove it, you can simply click the Delete hyperlink to the right of the service line and it will delete that service line and return you to the top of the claim screen. Once all service lines have been added and you're ready to submit your claim to ProviderOne, click the Submit Claim at the top of the claim screen. If your pop-ups are turned off, you will receive this dialog box. If you have backup documentation that needs to be attached to the claim, click the OK button. Simply click Cancel if there is no backup being sent. If you had no backup to attach and you clicked Cancel on the dialog box, you will come to the Submitted Dental Claim Details page. This provides you with your claim number and a summary of the charges being submitted. When you receive this confirmation screen, This means ProviderOne has all the required data needed. To finalize the claim, you must hit the Final Submit button to send it to ProviderOne. Once this final step is complete, you will be returned to a blank claim form. If you had answered OK to the question, "Do you want to submit backup to the claim?" you have the option of attaching the backup directly to the claim. To do this, you would use the drop-down for Attachment Type and select the appropriate option from the list. Then you must choose a transmission code from the next drop-down box as EL for electronic only or electronic file. Skip the line number box drop-down completely. You can then click the Browse button to search for the electronic file you want to attach to your claim. Once attached, click the OK button to return to the Submitted Dental Claim Details page. Scanning and attaching your backup electronically could result in quicker processing and adjudication of your claims. If you are faxing or mailing the backup documentation, complete only the attachment type drop-down, and the transmission code drop-down will be either BM for by mail or FX for fax. Click OK to return to the Submitted Dental Claim Details page. The next step for mailing or faxing your backup documentation is to create a cover sheet so that your backup can be matched up to your claim in ProviderOne. The information noted on this screen is used to complete the required cover sheet. Click the Print Cover Page button. This cover sheet will come up as a separate screen from ProviderOne as a PDF file. Complete the first drop-down to choose the Provider ID and PI and enter that number in the Provider ID field. Tab to the TCN field and enter the claim number you received on your Submitted Dental Claims Detail screen. Tab to the Date of Service field and click the drop-down to bring up the calendar. Use the calendar to choose the date of service you are billing for. If there is more than one date of service on your claim, you must use the earliest or oldest date in this field. Tab to the ProviderOne Client ID field and enter the 9-digit ProviderOne Services Card ID number, including the WA. You will need to tab twice after entering the client ID to expand the barcode so it can be properly read by the ProviderOne scanner. Click the Print Cover Sheet button and either mail or fax in the backup, depending on what option you chose on the backup screen. Your DDE claim will be held for 3 to 5 days, waiting for the backup to be received and attached to your claim. Now that you've completed the cover sheet for your backup, you must click the Final Submit button to send your claim to ProviderOne for processing. Once this final step is complete, you will be returned to a blank claim form. This slide provides some useful links for accessing resources on the new HCA website and for submitting questions on submitted claims through our Contact Us form. There are also 2 helpful email addresses noted if you need to reach out to the Dental Program Manager or need assistance on using the Provider Portal.
Hi everyone, this is Matt here. I will narrate for Marcy as she walks us through the direct data entry screen. Once you have accessed ProviderOne, you will need to select the appropriate profile for submitting claims. Marcy is going to choose the EXT Provider System Administrator profile from the drop-down list. Next, she will choose the online claims entry option on the provider portal. You will notice she received an error telling her she does not have sufficient rights to access this link. After clicking close on the error page, Marcy is going to demonstrate how you can change your profile from provider portal screen. She will click on the My Inbox drop-down at the top left of the screen. She will choose Change Profile and is now returned to the Select a Profile screen. Marcy will choose one of the correct profiles for submitting claims, the EXT Provider Super User Profile, and click Go. Now she will click on the Online Claims Entry option on the provider portal. This takes you to the claim submission screen where Marcy will choose Submit Dental. The first required field she will complete is the NPI and taxonomy code for the billing provider. The next step is to answer the question, is the billing provider also the rendering provider? Marcy will click No and enter a rendering, performing, or servicing provider NPI and taxonomy code. You will notice that ProviderOne moves your cursor from field to field. Next up is telling ProviderOne who the service was provided to. So Marcy will enter a client ID number from the ProviderOne services card, including the WA. For this demonstration, this is a generic ID for test purposes. She will expand the additional subscriber client information area by clicking the red plus. Marcy will enter the last name, date of birth, and gender. This client has no commercial insurance, so she will skip the other insurance information area and move to the claim information section. She will tell ProviderOne what date of service is and choose a place of service. The last required question is this claim accident related? Marcy will click the No Radio button. Moving to the basic service line items, she will tell ProviderOne what service code she is billing for and then enter the submitted charges. She next must enter the number of units. For the purposes of the demonstration, we will skip the remaining areas and add the service line to the claim by clicking the Add Service Line Item button. ProviderOne returns you to the top of the claim screen, and Marcy will use the service hyperlink to return to the service line area to verify her entries. She is happy with her entries, so she will return to the top of the claim screen to submit the claim by clicking the Submit Claim button. ProviderOne is asking if there is any backup documentation to attach to this claim. Marcy will click Cancel. This is a good time to make a note of the TCN number assigned to your claim for future reference, and you can verify the dates and billed amount. Marcy will finalize this claim by clicking the Submit button in the bottom right corner. The system returns you to the top of the claim form and clears out all the information entered. The claim form is ready for you to submit another claim if needed. This completes the live demonstration of submitting a dental claim using the direct data entry form of ProviderOne.